The coronavirus pandemic is making it dangerous for heroes and survivors to attend today's remembrance ceremonies. Many of them were diagnosed with severe illnesses like cancer or respiratory problems, which makes them more vulnerable to the coronavirus. The risk is so high that the New York City Fire Department asked members to skip services today. Grace Segers reports for CBSNews.com that the concerns surrounding first responders and COVID-19 are being overlooked because this is not a milestone anniversary. And Grace joins me now. She's a CBS News political reporter. Grace, welcome. So throughout the duration of the pandemic closures, we have heard doctors emphasize the importance of managing your mental health while social distancing. But this is something that goes a step further for those who survived 9/11. What are the concerns there? And how are the changes to this year's ceremonies amplifying those concerns?
Well, it's particularly hard for 9/11 first responders, in part because a lot of them have PTSD, post-traumatic stress. They have a lot of anxiety and emotional issues. And I talked to a first responder who said that the isolation that he's feeling in quarantine, it's just really difficult for him and difficult for him to handle emotionally. So there's that aspect of it. We also have the problem where, as he mentioned, so many first responders have pre-existing conditions. They have respiratory diseases, they have cancers. So going outside has become more fraught than it ever was before, because they were told after 2001 that the air was safe to breathe. And it wasn't. And now they're being told again by the government that they need to stay indoors. And so there's a feeling like they're being betrayed again by the government.
Right. And in fact, you spoke with someone who worked at Ground Zero in the aftermath of the attack, John Feel. He also started the Feel Good Foundation to help first responders. What did he tell you were his concerns about COVID-19?
Well, he's very active in the 9/11 community and in advocating for other first responders. So he told me that he was really concerned about all of his fellow first responders, not only getting cancer and getting these respiratory diseases, but also getting COVID on top of that. He said he was also concerned by some of the political rhetoric you see going around the COVID pandemic, how there has been a lot of politicization of wearing a mask, and how this can be really dangerous for first responders who, these are America's heroes, and if they're going out and they're around people who aren't wearing masks, they are far more susceptible to getting the virus and to having a more severe case.
And Grace, didn't Feel, in fact, catch the virus? How did he say it changed his life, and what are his new concerns?
He did, and it was just heartbreaking to hear him describe how he experienced it. It took him out of the game for months, and he really compared it to his 9/11 injury, where he had to have partial amputation in his foot from his 9/11 injury when a steel beam fell on his foot. And he said that much like this injury, the 9/11 injury, he feels as if the coronavirus has changed him. He feels like a different person. He said that he struggled to breathe, that every inch of his body hurt. And he feels like it's going to take him a while to recover, and that he's not the same person that he was before the virus.
It's really devastating to hear that. We hope he has a speedy and full recovery. Now, Grace, many have voiced concerns about the virus and the government downplaying the severity of COVID-19. What does the infection rate actually look like for survivors and first responders?
Well, it's interesting because I spoke to Dr. Benjamin Luft, who's at the Stony Brook World Trade Center Health and Wellness Program, which looks at the health of first responders. And he said that among first responders who are still active duty in their community, they're seeing a pretty high rate of infection because they're still essential workers. They're going out. But among the first responders who are now retired, they know about their pre-existing conditions. They know how dangerous this is for them. So they're staying inside and seeing a lower rate of infection among them.
Well, that is good news. But of course, we know that the 9/11 community of first responders has been very vocal about the federal government's response to them. And this community is constantly pushing the government to do more for first responders. Can you talk a little bit about their history with that and tell us more about the Victim Compensation Fund?
Yes. So you wouldn't necessarily believe this to be true, but it's actually been a real uphill struggle for nearly 2 decades for 9/11 first responders and survivors to get the kind of compensation that they need. So it wasn't until 2011 that President Obama signed an act reestablishing the Victim Compensation Fund for victims who were injured or have a 9/11 related illness. It was reauthorized in 2015, but then funding was running out for it before the deadline of 2020. So in 2019, you saw this really big congressional fight where all of these 9/11 first responders, many of them undergoing chemo, many of them very ill, coming down to the Capitol and lobbying members of Congress in person, saying that we need this to be renewed. And eventually it was renewed until 2090, signed by President Trump. And it is just a really great resource for survivors and first responders,
who we know continue to struggle with a whole slew of health challenges. Grace Segers, thank you so much for joining us.
Thank you.